Good day, everyone. Welcome to our rationalization of our semifinal examination. And I'm actually in charge of discussing the first 25 items of the examination. Let's begin with EE1, that's care of pediatric clients with neurologic disorder. Let's begin with question number one. The parents of an infant with myelomeningocele ask a nurse about their child's future mental ability. What is the nurse's best response? The keyword here is myelomeningocele and then future mental ability. What is the best response of the nurse? Letter A, about one third have an intellectual disability, but it's too early to tell about your child. Letter B, intellectual disabilities occur in about two-thirds of these children, and you will know soon if this will occur. Letter C, your child will probably be of normal intelligence since he demonstrates signs of it now. Letter D, you will need to talk with the healthcare provider about that, but you can ask later. So eliminate immediately letter D because that's an avoidance of answering what is being asked in the situation. So in this case, that is not answering what is being asked because the parents are actually asking you, therefore you need to answer them factually. Letter C also is actually going to be false reassurance because it doesn't guarantee that the child will have a normal intelligence growing when growing old, with the presence of pure myelomeningocele. And then the answer here is letter A. Letter B is actually wrong because that will actually going to be not a factual information because you have to wait up until the child will manifest it. The answer for this one is letter A. Approximately one third of infants diagnosed with myelomeningocele will actually have an intellectual disability, but the degree of disability is actually variable, and it's actually considered to be difficult to predict intellectual functioning, especially during neonates. And of course, the parents are asking for an answer now and should be told to talk with the healthcare provider later once you have actually provided that vital information. Number one, the answer is letter A. Number two, a nurse evaluates discharge teaching as successful when the parents of a school-aged child with ventriculoperitoneal shunt insertion identify which sign as signaling a block shunt. So in this case, the patient here has a ventriculoperitoneal shunt and a school age. And another clue is there is a block shunt. Letter A, decreased urine output with stable intake. Letter B, tense fontanelle and increased head circumference. Letter C, elevated temperature and reddened incisional site. And letter D, irritability and increasing difficulty with eating. So since this problem is talking about the brain, therefore we'll have to focus on an answer that is focused on the brain. So letter A is eliminated because that is focused on the kidney function. And letter C is also eliminated because it does not talk about, it is not related to the VP shunt, but elevated temperature might actually be related to possible infection. The best answer for number two is letter D. That's irritability and increasing difficulty with eating. So if there's presence of irritability associated with your ventricular peritoneal shunt blockage, and also there is a manifestation of lethargy, there's also possible vomiting, difficulty eating, is actually a manifestation of increased intracranial pressure that is brought about by a blocked ventricular peritoneal shunt. So we know that, as what I mentioned earlier, letter A is actually a manifestation that there is actually fluid loss from a source other than the kidneys. And if there is presence of a tense fontanelle, an increased head circumference, that could actually be a sign of a block shunt in an infant. But it should have to be associated with increase in intracranial pressure. So the elevated temperature and possible redness is indicating that there is actually an infection of the site. Number two, the best answer is letter D. Number three, the parent of an adolescent girl with Down syndrome tells a nurse that her daughter recently stated that she has a boyfriend. The parent is concerned that her daughter might become pregnant, which is the most appropriate suggestion made by the nurse. So the child here who has Down syndrome is actually acting as if there is a boyfriend. So what will be your response if the child is actually adolescent already? Letter A, I understand your concern. You may want to start your daughter on long-acting contraception. Letter B, women with Down syndrome are infertile, so you do not need to worry about her getting pregnant. Letter C, I understand your concern. You may want to enroll your daughter in an abstinence program. Or letter D, I know it may be difficult, but you may want to suggest that your daughter break off the relationship. So in this case, since the child here has Down syndrome, therefore there is a possibility of an intellectual disability to having a low average intelligence. So thus the adolescent's ability to make informed choices regarding sexual ability activity is actually considered limited. So the best answer for wrong, it will be eliminated immediately in your letter B, because that is non-therapeutic. So use the word worry, and then eliminate also letter D, because it might actually going to cause breakout of behavior for the kid or for the adolescent. So the best answer for number three is letter A. So, long-acting contraception, such as your IUD or having a progestin implant, can actually greatly reduce the risk of unwanted pregnancy. So, usually, most women who have Down syndrome are considered to be fertile. Therefore, letter B is eliminated because it says that women who with Down syndrome are infertile. That is considered to be an absolute. So, an abstinence program may not be effective due to the intellectual level of children with Down syndrome. Therefore, they will not be able to understand you regarding your instruction. And suggesting that the adolescent breaks up the relationship, that does not ensure that she will actually do it. So, answer here is letter A. Number four. A nurse is developing a plan of care with the parents of a school-age child client diagnosed with seizure disorder. What instructions should the nurse give the parents to promote the client's growth and development? So there is actually seizure disorder, and the focus is on growth and development. A, the child will need activity limitation and will be unable to perform as well as her peers. Letter B, there is potential for a learning disability and the child may need tutoring to reach her grade level. Letter C, the child will likely have normal intelligence and be able to attend regular school. Letter D, there will be problems associated with social stigma, and parents should consider homeschooling. Of course, we talk about here on growth and development. So the child is actually school age. So of course, if there is actually seizure disorder, it does not actually guarantee that there is actually learning disability. At the same time, uh, activity limitation is considered not to be needed. So letter A and letter B are eliminated, and the best option for this one is basically on letter C. Letter D is eliminated because it does not talk about the social stigma, but our focus here is about growth and development. So that is physiologic in nature, but not psychologic. So letter D is psychologic in nature. The best answer is letter C. There will be, or the child will have normal intelligence and be able to attend regular school. So most children who actually has seizure disorder during infancy will have an intellect who will actually be intellectually normal. So a child may be having a seizure disorder needs the same experience and opportunities to develop intellectual, emotional, and social abilities as any other kids. So answer for number four is letter C. Number five. A preschooler with pneumococcal meningitis is receiving intravenous antibiotic therapy. When discontinuing the intravenous therapy, the nurse allows a child to apply a dressing to the area where the catheter is removed. The nurse's rationale for doing this is based on the interpretation that a child in this age group has a need to accomplish which goal? A. Trust those caring for her. B. Find diversion activities. C. Protect the image of an intact body. Or letter D. Relieve the anxiety of separation from home. What is asked is actually about the catheter that is being removed. So the most important thing that we know that if there's actually going to be a catheter, there is actually an impaired uh, intact skin. So of course, preschool children would actually worry about having an intact body and become fearful of any threat to body integrity. So allowing the child to participate in required care helps protect her image of an intact body And development of trust is actually typically associated with an infant. So here we are already having school age, and additionally, allowing the child to apply a dressing over the intravenous insertion site is unrelated to the development of trust. Finding diverse activities is not a priority need for a child in this age group, and separation anxiety is more common in toddlers than in preschoolers. So, best answer for number five is letter A: protect the image of an intact body. That's letter C: protect an image of an intact body. Number six: the parents of a child tell the nurse that they feel guilty because their child almost drowned. Which remark by the nurse would be most appropriate? A: I can understand why you feel guilty, but these things happen. Letter B: tell me a bit more about your feelings of guilt. Letter C: you should not have taken your eyes off of your child. Or letter D: you should focus on the fact that your child will be all right. Letter D is a false reassurance, and letter C is actually you are reprimanding the parents. That's actually a non-therapeutic statement. So the best answer for number six is letter B. And letter A: I can understand why you feel guilty, but these things happen. As much as possible, when you talk about your therapeutic communication, you should not ask why, because that requires an explanation. So guilt is considered a common parental response. The parents needs to be allowed to express their feelings openly in a non-threatening and non-judgmental atmosphere. Telling the parents that these things happen does not allow them to verbalize their feelings, and telling the parents that they should not have their taken eyes off or their taken their eyes off the child's blame them, possibly further contribute to their guilt. And telling the parents that they should not feel guilty denies the parents feelings of guilt and is inappropriate. Telling the parents that they are lucky that the child will be okay does not remove the feelings of guilt. Answer for number six is letter B. Number seven: the parent brings a child to the clinic after discharge from the hospital for Guillain-Barré syndrome. Which statement by the parent indicates that the discharge plan is being followed? A: she and her sister argue all day. Letter A is eliminated because that is actually absolute because of the word all. Letter B: I have to bribe her to get her to do her exercises. Letter C: I take her to the pool when she can exercise with other children. Or letter D: she has missed a few of her therapy sessions because she often sleeps. So, if the child has Guillain-Barré syndrome, of course, there's a need for us to have a developmental appropriate activities, and a therapeutic play should be used as a rehabilitation modalities. So, having this child to a pool to exercise with other children indicates that the child is in participating in exercise as well as engaging with other children, thus fostering development. Arguing the sister does not address the discharge plan, and inappropriate rewards or threats should not be used to coerce a child into compliance. Although the mother is attempting to comply with the discharge plan, bribery is an appropriate technique to foster compliance, and missing therapy sessions delays recovery. The parents need to help set the child's schedule to ensure that she gets adequate rest to be able to follow her treatment plan. Therefore, number seven is letter C. Number eight: the nurse teaches an adolescent about returning to school after concussion, which statement by the client reflects the need for further teaching. We're looking for a wrong answer here because it tells us that need for further teaching. Letter A: I should limit my activities that require concentration. Letter B: I must slowly return to my previous activity level as my symptoms improved. Letter D: my symptoms may emerge with exertion. Letter D: time is the most important factor in my recovery. So we know that proper management of activity, such as avoiding re injury and monitoring symptoms, are critical for recovery after a concussion. So, recovery often depends on the gradual return to physical and cognitive activities based on symptom resolution, not just the passage of time. So, misunderstanding this could lead to poor self care and potentially worsen outcomes. Therefore, what is wrong here is letter D, because time is actually not the mere importance of returning to school, especially after the concussion. Number eight is letter D. Number nine: which statement by the parent of a school age child who has a craniotomy for brain tumor would further warrant exploration by the nurse? So, exploration Letter A. After this, I will never let her out of my sight again. Letter B. I hope that she'll be able to go back to school soon. Letter C. I wonder how long it will be before it she can ride her bike. Or letter D. Her best friend is eager to see her. I hope she won't be upset. So, of course, we know that parents of a child who has undergone neurosurgery can easily become overprotective. Yet, the parents must foster independence in the convalescing child or recovering child. It is important for the child to resume age appropriate activities, and parents play an important role in encouraging this. So, statement about going back to school would be expected. Parents want the child to return normal activities after a serious illness or injury as a sign that the child is actually doing well. Number nine, the answer here is letter A. That needs to have further explanation because you are promoting dependence. Number 10, 2 months after the adolescent's thoracic spinal cord injury he has a pounding headache. The nurse notes that the client's arm and face are flushed and he is diaphoretic. What should the nurse do next? Letter A. Check the patency of the urinary catheter. Letter B. Lower the adolescent's head below his knees. Letter C. Place the adolescent flat on his back. Letter D. Prepare to administer epinephrine subcutaneously. So in this case, it is not that an emergency because it is considered to be an emergency, but epinephrine is considered to be a vasopressor. And we know that if this is actually the case, when there is a pounding headache, it is also associated with hypertension. So we're suspecting here that a patient has uh, autonomic dysreflexia. So usually, autonomic dysreflexia is associated with a full bladder. So the answer here is letter A. Check the patency of urinary catheter. So that is because of the full bladder, there is autonomic dysreflexia, which is considered to be simulating the sympathetic response. And of course, there is an immediate treatment involves eliminating the cause. Therefore, it's very important for you to check for the catheter. Lowering the head would increase the blood pressure, and it is contraindicated, especially because there's presence of spinal cord injury. And lying flat does not decrease the BP, and as what I mentioned, your epinephrine thus increases the BP further. Number 10, the answer is letter A. 11. The healthcare provider prescribes carbamazepine extended release for a client with cerebral palsy who has also a seizure disorder. The client has a gastrostomy tube feeding and carbamazepine is on the hospital no crash list. What should the nurse do in order to administer the medication? A. Cut the medication into four pieces. Letter B. Dissolve the medication in 30 ml of juice. Letter C. Ask the pharmacist for an oral suspension. Letter D. Contact the healthcare provider to change the prescription. Of course, in this case, because that is for an extended release, then it should not be crushed because there is a no crush policy. So, as a patient advocate, you have to contact the healthcare provider to change the prescription. So the coating on an extended release medication helps assure slow absorption of the medication. And if the nurse crushes the medication may enter the client's system too quickly and result in toxic levels. The only appropriate action is to contact the prescriber and ask that the prescription be changed, and cutting the medication or trying to dissolve a whole tablet would have similar results as crushing it. And carbamazepine comes as an oral suspension, but it is not an extended release. Therefore, a prescription would be needed to address dosing if switching to this form. 11, the best answer is letter D. Contact the healthcare provider for the change of prescription. That's number 11. Let's proceed now to number 12. When making rounds on the pediatric neurology unit, the nurse manager notes that when giving IV medications, many of the staff nurses are disconnecting the flush syringe first and then clamping the intermittent infusion device. The nurse is concerned that the nurses do not understand the benefits of positive pressure technique and turbulence flow flush in preventing clots. After the nurse manager discusses the problem with the staff educator, which intervention would be the most effective way to improve the nursing practice. Letter A, create a poster presentation on topic with a required post tests. Letter B, send the group email discussing the importance of clamping the device first. Letter C, ask each nurse if he or she is aware that his or her practice is not correct or current, or post an evidence-based article on the unit. So the best answer for number 12 is letter A. So the poster presentation is actually an eye-catching way to disseminate information that can be used to educate nurses on all shifts. The addition of the post test will verify that the poster information has been received, and because of the large volume of emails the typical employee receive, information sent this way may be overlooked. It if several nurses are considered not using the most current practice, it is quite possible many more do not understand it. Thus, a larger scale plan is needed, and posting an article will not assure that that the information is actually read by the nurses. So answer here is letter A. Number 13. During a developmental screening, the nurse finds will now focus on musculoskeletal disorder. Number 13. During a developmental screening, the nurse finds that a toddler with cerebral palsy has arrested social and language development. What should the nurse tell the family? A. This is a sign that cerebral palsy is progressing. Letter B. Your child has reached his maximal language abilities. Or letter C. I need to refer you for more developmental testing. Or letter D. We need to modify your therapy plan. So in this case, it is important to identify primary developmental delays in children with CP and to prevent secondary and tertiary delays. The arrested development is worrisome and requires further investigation. It is possible the lack of developmental delay indicates a hearing loss or maybe a sign of autism. The brain damage caused by cerebral palsy is not progressive, and the brain of a young child is quite plastic. Assuming that the child's development has peaked at age 3 would be a serious mistake. The therapy plan will need to be modified, but a better understanding of the underlying problem will lead to the greatest chance of creating a successful therapy plan. Therefore, the answer here is letter C. There's no need for us to modify them immediately, but we need to refer it for further testing. That's letter C. 14. The parent asks the nurse whether a child with hemiparesis due to spastic cerebral palsy will be able to walk normally because he can pull himself to a standing position. Which response by the nurse would be most appropriate? A. Ask your healthcare provider that or she thinks at your next appointment. Letter B. Being able to pull to a stand really only tells us her body strength is good. Letter C. It is difficult to predict, but his ability to bear weight is a positive factor. Then letter D. If he really wants to walk, and works hard, he probably will eventually. We'll eliminate immediately letter B because of word only because that's absolute. The nurse needs to respond honestly to to the mother, and most children with hemoptysis due to spastic cerebral palsy are able to walk because the motor deficit is usually greater in the upper extremity. There is no need to refer to the mother to the healthcare provider, and pulling to stand requires both upper body and lower body strength. The will to walk is important, but without neurologic stability, the child may be unable to do so. 14, the answer is letter C. 15. The parent of a child with Duchenne's muscular dystrophy asks about the chance that the child will have the disease. What should the nurse tell the parent? Letter A, sons have a 50% chance of being affected. Letter B, daughters have 1 in 4 chances of being carriers. Letter C, each child has 1 in 4 chances of developing the disease. And letter D, each child has a 50% chance of being a carrier. So of course we know that this Duchenne's muscular dystrophy is an X-linked recessive disorder. So if that's gonna be an X-linked recessive disorder, the gene is transmitted through female carriers to the affected sons. That is actually 50% of the time. So daughters have a 50% chance of being a carrier, but a son has a 50% of having having been affected. So number 15, the best answer is letter A. 16. The nurse teaches the parent of a young child with Duchenne's muscular dystrophy about a disease and its management. Which statement by the parent indicates successful teaching? Letter A. My son will probably be unable to walk independently by the time he is 9 to 11 years old. Letter B, muscle relaxants are effective for some children. I hope they can help my son. Letter C, when my son is a little older, he can have surgery to improve his ability to walk. And letter D, I need to help my son be as active as possible to prevent progression of the disease. So, of course, we know that muscular dystrophy is a progressive disease, and children who are affected by the disease usually are unable to walk independently by 9 to 11 years old. And the best answer for number 16 is letter A. There's no effective treatment for childhood muscular dystrophy, and although children who remain active are able to avoid wheelchair confinement for a longer period, activity does not prevent disease progression. 16 is letter A. 17. When teaching the family of an older infant who has had a spica cast applied for developmental dysplasia of the hip, which information should the nurse include when describing the abduction stabilizer bar? A. It can be adjusted to a position of comfort. Letter B. It is used to lift the child. Letter C. It adds strength to the cast. Or letter D. It is necessary to turn the child. Of course, the abduction bar is incorporated into the cast to increase the cast strength and maintain the legs in alignment. The bar cannot be removed or can be adjusted unless the cast is removed and a new cast is applied. The bar should never be used to lift or turn the client because doing so may weaken the cast. So answer for number 17 is letter C. It adds strength to the cast. 18. A parent asked a nurse about using a car seat for a toddler who is in hip spica cast. What should the nurse tell the parent? A. You can use a seat belt because of the spica cast. Letter B. Will need a specially designed car seat for toddler. Or letter C. You will use the car seat you already have. Or letter D. You will need to get a special release from the police so that a car seat will not be needed. Of course, we will not directly talk about the police this time. And of course, letter B and letter C are opposing. And since there is a spinal cast or a hip spica cast, there is a need for a modified car seat. So the answer here is bravo. So the toddler in hip spica cast needs a specially designed car seat. The one that the parent already has will not be appropriate because of the need for the car seat to accommodate the cast and abductor bar. So number 18 is letter B. 19. The nurse is discharging a baby with clubfoot who has had a cast applied. The nurse should provide additional teaching to the parents if they make which statement? A. I should call if I see changes in the color of toes in under the cast. Letter B. I should use a pillow to elevate my child's foot as he sleeps. Letter B. My baby will need a series of casts to fix her foot. Or having a cast should not prevent me from holding my baby. Of course, elevating the extremity at different points during the day is helpful to prevent edema and swelling, but pillow should not be used in the crib because they increase the risk of sudden infant death syndrome. That's why there is a need for us to have an additional teaching. A change in the color of the toes is a sign of impaired circulation and requires medical evaluation. Typically, children need a series of 5 to 10 casts to correct the condition or the club foot. So the answer here is letter B because that is requiring further teaching. That's 19 is letter B. 20. After teaching the parents of an infant with club foot requiring application of a plaster cast, how to care for the cast, which statement would indicate that the parents have understood the teaching. So in this case, in your test paper, we only have choice letter C immediately. It's actually up until choice letter C, but in the key answer there is actually letter D, but it's not the correct answer. So the correct answer for number 20 is we will check the color and temperature of the toes of the casted leg or frequently because that is preventing a compromised neurovascular integrity of the extremity. So the manifestations might include edema, pauselessness, color alteration, and inability to move the distal exposed extremity. Diba? We have 6 P's: the pain, pallor, paresthesia, pauselessness, uh, paralysis, and of course your hypothermia. So the legs would be elevated by swelling were present. And of course, letter D petaling, which are applied to cover the rough edges of the cast, are to be left in place to minimize the risk of skin irritation from the cast edges. So 20 is letter C. 21. The mother of a preschool child with GIA or your juvenile idiopathic arthritis is worried that her child will have to stop attending preschool because of the illness. Which response by the nurse would be most appropriate? It may be difficult for the child to attend school because of the side effects of the medication he will be prescribed. Letter B, your child will be encouraged to attend school, but he will need extra time to work out early morning stiffness. Letter C, you should keep your child home from school wherever he experiences discomfort or pain in his joints. Or letter D, your child would probably need to wear splints and braces so that her joints will be supported properly. So socialization is important for the school age child. The activity is important to maintain function, and because children with GIA commonly experience the most problem in the morning after arising, they need to have more time to warm up. And adverse effects may or may not occur. A child's routine needs to be maintained as much as possible, and although splints and braces may be needed, they're worn during periods of rest, not during the activity, to maintain function. So the best answer for number 21 is Bravo. 22. What information should the nurse include when developing a teaching plan for the parents of a child with juvenile idiopathic arthritis who is being treated with naproxen? Letter A, anti-inflammatory effect will occur in approximately 8 weeks. Letter B, within 24 hours, the child will have anti-inflammatory relief. Letter C, the nurse should be called before giving the child any over-the-counter medication. Letter D, if a dose is forgotten or missed, the dose is not made up. So the first group of drugs typically prescribed is the NSAIDs, which include naproxen. Once therapy is started, it takes hours or days to relief from pain to occur. However, it takes 3 to 4 weeks for anti-inflammatory effects to occur, including reduction in swelling and less pain with movement. And naproxen is included in only a few over-the-counter medications, but aspirin is in several. The family should check the nurse before giving any over-the-counter medications. Toxicity or GI bleeding may occur with NSAID when they are actually combined. The missed dose will need to be made up to maintain the serum level and to maintain therapeutic effectiveness of the drug. Therefore, the answer here is letter C. 23. The nurse is helping a family plan for the discharge of their child who will be going home in a spica cast. Which information would be most important for the nurse to consider? A, the bathrooms are all on the floor, so rather than letter A because of the word all. The child's bedroom is on the second floor. Letter C, a 16-year-old sister will care for the child during the day, or there are 3 steps up at the front door. So the child is what the hip spica cast is going home and has a bedroom on the second floor of the home needs to have bed moved to an area that is more centrally to family life. Negotiating a flight of steps at twice a day on awakening in the morning and before going to bed, well, with a child with hip spica would be difficult and most likely dangerous because a child is in a hip spica will need to use a bedpan or urinal, and the bathrooms can only be on any floor. Because the family is involved in the discharge, the 16-year-old sister should be taught appropriate care along with the best of the family. The child can be carried up and down the 3 steps to the house the few times necessary after discharge. So 23 is letter B. 24. A child with newly diagnosed osteomyelitis has nausea and vomiting. The parent wishes to give the child ginger cookies to help control the nausea. What should the nurse tell the parents? You can try them and see how it does. How he does. I will need to get a prescription. You will need Your child needs medication for the vomiting. We discourage the use of home remedies in children. Letter A and D are opposing, so one of which is actually correct. B and C are eliminated. Some clients find ginger cookies or snaps help relieve nausea, and ginger in small amount or dosage such as would be found in cookies have few side effects. There's no reason that the parent should not try this dietary intervention. However, the nurse must monitor the client's response. If the child has a diet as tolerated to prescription, there's no need for an additional prescription, and ultimately, The child may need an antiemetic medication, but better strategies are often successful in treating vomiting related to osteomyelitis. Making a universal statement this regarding home remedies is not a client-centered approach. So 24, the answer is letter A. We're down now to our last number. A pediatric client with scoliosis has to wear a brace. The nurse should develop a teaching plan with the client to include which instruction: wear the brace during waking hours, use lotions to relieve skin irritations, wear a form-fitting t-shirt under brace, bathe the skin under the brace once per week. So the answer here is letter C. A form-fitting t-shirt can be worn under the brace to prevent skin irritation and collect respiration. Braces are worn 23 hours each day, and lotions because irritation should not be used. The skin under the brace should be bathed daily to help prevent irritation from the brace. The brace can be removed for bathing so all the skin can be bathed. So that is it. We're done with our rationalization for our semi-final examination. Thank you very much. Congratulations to everybody.